Your blood type may quietly shape how easily your blood clots, how severely you react to certain infections, and how your blood vessels age. Not by a huge amount, but by enough that it shows up in large studies, again and again. And yet, most people treat blood type like a label you only need in an emergency. A form, a donor card, a quick answer at the hospital desk. But that is a very narrow way to look at it. Your blood type does not decide your fate, and it does not override sleep, diet, movement, stress, or family history. But it may shape part of the biological terrain your body is working with. The way blood tends to clot, the way certain microbes attach more easily, the way inflammation or vascular risk may show up in one person a little differently than another. That is where people get this topic wrong. They hear one dramatic claim and assume blood type explains everything. Or they hear one skeptical take and assume it means almost nothing. The truth is less dramatic, but more useful. Blood type is not a verdict. It is more like a bias built into the system, a nudge, not a sentence. So the real question is not, which blood type is bad? The real question is, what kind of trade-off comes with each type? And what are people most likely to miss because they keep treating it like just a letter? To see why this matters, you have to zoom in from the label to the surface. Your blood type comes from small sugar markers on the outside of your red blood cells. Type A has one pattern. Type B has another. Type AB carries both. Type O leaves the base structure unchanged. Those markers matter in transfusion medicine, but not only there. ABO-related molecules also show up on other cells and in body fluids, which helps explain why blood type can be linked to clotting behavior, infection susceptibility, and how some tissue linings interact with the outside world. A simple way to picture it is this. Blood type is less like a name tag and more like the finish on the outside of a surface. Change the finish, and other things may stick, slide, or signal a little differently. That is especially important for clotting. One of the clearest links in the literature involves type O. People with type O tend to have lower levels of two proteins involved in clot formation. One is called von Willebrand factor. The other is factor VIII. Reviews have noted that healthy group O individuals often have roughly 25% lower von Willebrand factor levels than non-O groups, and non-O status has been associated with higher risk of venous blood clots. That does not mean every non-O person is heading toward a clot, or that every O person is safer. It means the baseline terrain may not be identical, and this is where the topic gets useful, not dramatic, useful. If blood type changes part of the terrain, then the smarter question is not which type wins. It is where might each type carry a different trade-off, and what gets misread because people assume all bodies start from the same baseline. That is the lens we are going to use from here. Start with type O, because this is where people usually make the biggest wrong assumption. They hear O and think safer, cleaner, simpler. Not exactly. The more accurate way to frame type O is lower clotting tendency, but with a trade-off. Group O is consistently linked to lower baseline levels of von Willebrand factor and factor VIII, which helps explain why O often sits on the less sticky side of the spectrum, while non-O groups tend to carry more risk of venous blood clots. But the other side of that trade-off is bleeding. In review literature and in bleeding-focused studies, type O has been associated with greater bleeding tendency in some settings. So if you're type O, the practical takeaway is not good blood or bad blood. It is this: your baseline may lean a little less toward unwanted clotting, but that does not make you invincible, and it may matter more when bleeding risk is already on the table. Surgery, dental work, heavy periods, easy bruising that keeps repeating. A nosebleed pattern you have always dismissed as just one of those things. That is useful context, not a diagnosis. There is also a second pattern that makes type O more interesting than people think. Some gastrointestinal infections and ulcer-related pathways seem to interact with blood group biology. The cleanest signal is not type O catches everything. It is narrower than that. Blood group O has been linked to more severe cholera, and ABO, or secretor biology, also affects susceptibility to some norovirus strains. With H. pylori and ulcers, the literature points to a long-standing association, but it is not perfectly settled in the simple one blood type, one outcome way people online often claim. Type A is where people often want a dramatic one-line verdict, but the honest answer is more boring and more useful. The strongest signal is not that type A has its own completely separate destiny. It is that type A lives inside the non-O side of the spectrum, where clotting-related markers tend to run higher than they do in type O. Large cohort and review data have linked non-O blood groups with modestly higher risks of venous blood clots and some cardiovascular outcomes. But modest matters here. This is not a verdict. It is a baseline tilt that matters more when it meets other risks like long sitting, smoking, estrogen therapy, surgery, or uncontrolled blood pressure. Type B is where people often expect a dramatic hidden profile, and that is exactly where the science gets thinner than the internet makes it sound. The clearest signal is still the broader non-O pattern, not a special daily life script that belongs only to type B. So if you're type B, the real takeaway is not that you carry some mysterious curse. It is that your blood type may add a small background tilt, but the bigger story still comes from the stack around it. Blood pressure, smoking, activity, medications, family history. Then there is type AB, where rarity tends to attract myth. AB still sits inside the non-O cluster for clotting-related risk. One prospective study linked AB blood type to later cognitive impairment, and an American Academy of Neurology summary highlighted an 82% relative increase in that cohort. But that does not mean 82% of AB people develop cognitive decline. It reflects relative risk within one study population, and later findings have been more mixed. So the practical read is caution, not prophecy. If you're AB, it makes sense to take vascular health seriously, because brain health and vessel health are not separate stories. Now add the minus sign. Rh negative status matters most in transfusion compatibility and pregnancy, especially when an Rh negative pregnant person is carrying an Rh positive fetus. That is where Rh immune globulin becomes important. Outside those settings, Rh negative is often overpackaged online as a daily wellness identity, and the evidence for that is weak. So where do you start with all this? Not by turning your blood type into a personality. Start by using it as one layer of interpretation. If your type O and bleeding issues keep showing up, mention it. If you're non-O and you're also stacking classic clot risks, treat that combination with more respect. If you are Rh negative and pregnancy is relevant, do not leave that conversation vague. That is the practical line. Know the terrain, then look at the rest of the map. And this is the part I do not want you to miss. Blood type can shape part of the background. It does not replace the basics. It does not outrank blood pressure, sleep, insulin resistance, smoking, visceral fat, movement, or family history. In real life, those usually matter more. So do not use your blood type to panic, and do not use it to tune out. Use it the same way you would use any good piece of biological context, as a clue that helps you ask better questions and notice patterns earlier. Blood type is not a verdict. It is a bias in the system. And once you see it that way, you stop treating health like a mystery and start reading it more clearly. So now I want to hear from you. What is your blood type? And had you ever connected it to any of these patterns before?